Hello and welcome to the Pharmalearning channel. In this episode, we'll be covering fungal infections. So where can fungi grow? Well, lots of places, including nails, feet, scalp, genitals, and other parts of the body. Fungi thrive in warm, moist environments. Fungal nail infections usually affect toenails, but they can affect fingernails too. You're more likely to get a fungal nail infection if you have other fungal skin infections like athlete's foot. We'll talk more about that later. Nails can appear thicker and discolored, typically a green-yellow color. It's usually painless, but walking can become uncomfortable. Sometimes these infections resolve on their own. However, if one or two nails are affected, if the patient is really unhappy with their nail appearance, or if the patient has a condition that increases the risk of complications, then topical antifungal treatment can be used. Fungal nail infections can reoccur more commonly in the elderly from repeated nail trauma, nail biting, and constant washing. People with diabetes, psoriasis, Raynaud's, and those that are immunocompromised are more likely to suffer from fungal nail infections. Amyrolfin 5% nail liquor is available for adults over the counter in a pharmacy. It should be applied once or twice weekly to the affected nails after nail filing. Treatment should be continued for 6 months for fingernails and 9 to 12 months for toenails. It's a fairly lengthy treatment process. For the duration of the treatment, nail polish and artificial nails should not be worn. Patients should be advised to maintain good foot hygiene too. TIOCONAZOLE is another solution that can be applied to the nail. It's available on prescription, although research suggests it does not work as well as amyrolfin. If topical treatment is unsuccessful, oral antifungal treatment can be used. Treatment choice depends on the type of infection. Options include terbinafine and itraconazole. If terbinafine and itraconazole are not tolerated or are contraindicated, Griseofulvin is considered. However, Griseofulvin has a lower efficacy and a higher incidence of adverse effects in comparison. Fungal nail infection is rare in children under 12. Topical antifungal treatment is often ineffective, and oral treatment are off-label in this age group, so treatment should be initiated by a specialist. Athlete's foot is a fungal infection that affects the feet. The skin may appear flaky, sore, and red. It's common in those with sweaty feet. Treatment is available as creams including terbinafine 1% and imidazoles like CLOTRIMAZOLE 1% and miconazole 2%. These can be purchased over the counter for specific age groups. Alternative options include preparations containing 1% tolnaftate, like Scholl's Athlete's Foot Powder. A corticosteroid like hydrocortisone 1% cream can be used in areas of inflammation once a day, normally for a week. A combination of hydrocortisone and miconazole is available over the counter as DAKTARIN. Miconazole on its own is available as DAKTARIN. CLOTRIMAZOLE is also available over the counter as Canesten. If topical preparations are not working or if the infection is extensive, similarly to nail infections, terbinafine is recommended first line, followed by itraconazole and Griseofulvin. Despite its name, ringworm is an infection with a fungus, not a worm. It's a common infection that presents as a silver or red, circular, itchy rash. Ringworms can appear on the body, groin, and scalp. The same treatment choices should be followed with mild body and groin infections, commonly known as jock itch. Good hygiene should be maintained by washing affected skin areas daily, and towels should not be shared. This reduces the likelihood of passing the infection on. With fungal scalp infections, the scalp can appear scaly. Patients should be advised to soften any crust on their scalp and to tease them away with a comb. It is possible that hair may fall out and leave bald areas, which can be alarming, but patients should be advised that hair grows back once infection is treated. Griseofulvin is the only licensed oral antifungal agent for the treatment of fungal scalp infection in children. Terbinafine is an alternative. Itraconazole is used when both Griseofulvin and terbinafine are contraindicated. Duration of treatment is normally between 4 to 8 weeks. Often, topical treatment is co-prescribed. Options include selenium sulfide 2.5% shampoo licensed in adults and children over the age of 5. Ketoconazole 2% shampoo is licensed in over 12-year-olds. Both can be purchased over the counter to be used at least twice weekly for 2 to 4 weeks. In children under 5, an imidazole cream like miconazole can be used daily for 1 week. Candida is a yeast, which means it's a kind of fungus. A common name for Candida infections is thrush. These infections are often around the genitals and in the mouth. Oral thrush often affects babies. It causes white patches and red spots that can bleed. Babies can pass on oral thrush through breastfeeding. This can cause nipple thrush in mothers. Adults can develop oral thrush from taking antibiotics, from steroid inhaler use, or those with weakened immune systems. DAKTARIN oral gel containing miconazole can be bought over the counter for adults, children, and infants over 4 months. If miconazole oral gel is unsuitable, oral NYSTATIN suspension can be offered, available only on prescription. Typical dose is 1 drop, 100,000 units, 4 times a day for 1 week. Fluconazole 50 mg for 7 days can also be prescribed in adults. Moving on to vaginal thrush. Symptoms include a white discharge, stinging, and itchiness. For women between the age of 16 and 60, over-the-counter products like CLOTRIMAZOLE, available as pessaries and creams, can be used. Oral fluconazole 150 mg as a single dose can also be purchased. For recurrent vaginal thrush, this should be referred to a GP. Longer treatment may be needed, or there may be an underlying issue that needs to be resolved, such as poorly controlled diabetes. It is important to get thrush in men diagnosed by a GP to rule out things like balanitis or an STI. Until next time, thank you for listening. Don't forget to subscribe to our YouTube channel. You can also find Pharmalearning on Instagram, Twitter, and Facebook.